Thank you all for having me. Outcomes measurement at the NDIS. We think about this in lots of different ways. John Walsh said in his speech that the NDIA has defined financial sustainability as two things. One is that the cost of the scheme needs to be affordable by taxpayers, not now and into the future, and also that we get good outcomes for our participants, and they think that they're getting enough money to achieve those outcomes. So in doing that, we thought we need to set about going about an outcomes measurement framework, and we do it in quite a few different ways. So in each individual participant plan, they set goals, and we're looking at a robust way in which we measure success towards those individual goals. We also get a lot of information about our participants and their families and carers' satisfaction with interacting with the NDIA. So how was their planning experience, or how was their post-implementation meeting? We also get feedback from our providers and our other stakeholders in terms of how they perceive actually working with the NDIA and look at ways in which we can then improve going forward. We look at economic benefits, so we link our data with other government services so we can understand, well, if we get more participants in employment, as an example, what impact might that have on income support payments, and what might the flow-on effect be to GDP. Obviously, we've got our actuarial monitoring, which looks a lot at the costs and how the trajectories of participant costs are changing over time. And we've also got our outcomes framework questionnaires, and that's what I'm going to talk about in this talk. So the outcomes questionnaires, some of you might have seen this before. Basically, they measure progress towards a common set of goals, which are accepted by each participant. So we can aggregate up those goals and understand how the scheme is making a difference and areas in which we can improve. So different from a participant's individual goals, these are ones that we feel that everyone should be working towards. We've set these outcomes measures up so we can benchmark against other Australians without disability and also benchmark to other OECD countries. I should also point out we don't just collect them on our participants, we also collect them on our families and carers of our participants. To put it into context, we also collect a lot of other data in our administrative data sets. So we know a lot of information about a participant, we know their disability, we know some functional information, their age, where they live, etc. We know what goes in their plan. So with that, we can then start thinking about, well, what is actually achieving good models of support? Which providers are getting good outcomes for participants like me? So trying to use the information to then improve outcomes across our population. One example, for example, would be looking at employment and getting participants into employment. We can develop models which look at which providers might be getting participants into employment more so than others, and be able to put that information out there to our participants. In terms of how we looked at our outcomes framework, it's really quite a social determinant framework. It looks at a lot of aspects of life. We talked a lot to our participants about what matters to them. We also looked at what was happening internationally and in Australia in terms of outcomes frameworks. And we looked a lot at population data. So we're able to benchmark some of our questions with what's happening across the rest of Australia. So we looked at a lot of ABS data and also some of the longitudinal studies that are happening in Australia. You can see there in terms of our domains, we have them across the lifespan, recognising that they differ a little bit between birth and school, and then school to leaving school, and then older adults. But our domains are around choice and control, daily living, so assisting with daily living, relationships, home, health and wellbeing, lifelong learning, work, and social community and civic participation. Probably an important thing to say with our outcomes framework is the NDIS can't impact all of those domains. We've chosen to collect the information anyway, though, so we can get a more fulsome picture of people with a disability and also work with other mainstream services to improve outcomes across the board. So in particular, home, we're heavily dependent on the housing department. In terms of health, similarly, the health department, education, etc. But we have chosen to collect the info so we get more of a fulsome picture. In terms of then what's going to come out of the data, we measured the baseline set of outcomes indicators when people entered the scheme. And we've done that from 1 July 2016, and we've got that on about 99% of our participants. So worked hard to do that over the 3 years that we've been operating. you can already start to see some pretty big differences in terms of people not coming in on equal footing. So there's just an example there of our participants aged 15 to 24, and we've compared participants with a sensory disability compared with participants with a psychosocial disability. So in terms of happiness with the level of independence control, it's 57% when they enter the scheme for sensory disability compared to 28% for psychosocial. In terms of rating their health as excellent, very good or good, we've gone from 86% in the sensory disability to 41% for psychosocial, and also working 40% for sensory compared with 14% for psychosocial. In terms of where we think we are starting to make differences, obviously some of the indicators might have a short-term impact effect, while others quite long-term. So things like support for domestic tasks, you can see their baseline to review, quite a big jump in terms of percentage points for a year. Spending time doing activities that interest them, that's also gone up significantly in a year. However, people in a paid job has not gone up. We think that's probably a longer term goal that we need to work on to get more participants with a disability into work. Should also put up a little bit of a plug here for our website. So we've worked pretty hard to start releasing our data publicly. So there's a lot of information now about participant outcomes. There's deep dives on different participant groups and information on market. So get on there and have a look, click around. I've just got a couple of slides if I've got time, Emma, or? Zippy. Okay. So just in terms of a couple of things that are coming out of the baseline, they're coming out of our outcomes indicators. So if we look at participants birthed before school. So there you can see on our baseline indicators, a bit more than half of our participants, 60%, performing well on some of our key indicators across development, friendships, participation in community. And it's probably the age group where we've seen the biggest impacts over a year. So in terms of, for example, participation in family life, it's gone from 67 to 73. And participation in community activities has also increased from 64 to 70. Of course, the data is cut across all of our participants. We can look at it by geography, and we do. It's often interesting comparing the indicators between major cities and our regional and remote locations. So, for example, probability of having concerns in 6 or more areas of child's development, that was higher in major cities compared with outer regional and remote locations. But the probability of a child helping their parents and carers outside of the home was much higher for our regional and remote locations compared to major cities. Also looked a fair bit at community participation in terms of where we're at. I'll flick through that one. So in terms of our participants who are aged 25 and over, we've got 25% are in a general community group, another 11% in a community group but with other people with a disability. We've said no, 27% said no but they'd like to be, and 37% say no and they don't want to be. So really quite low numbers when you consider this against the Australian population. I'll skip over that one, but we can compare with Australian data as well. What I was going to point out in terms of community participation, it has increased substantially over the year for people in the scheme, aged 15 and over. And interestingly too, I think what's important is we're starting to see a lower proportion of people who don't want to be involved, which is good. So having some positive impacts in terms of increasing community participation. We also can look at it by disability group. In particular, people with Down syndrome have increased their participation significantly, but you can see that across most disability groups we've gotten some improvement over the year. So thank you.